Hello, everybody. We'll give folks a couple seconds to kind of filter in. Welcome to our first membership education series program for 2024. I know you guys have been excited to get started with programs, and just kind of a reminder for maybe some new folks or older folks too that are used to these programs. We're changing them a little bit this year, and that we're doing one a month. So today is our February program, and we're welcoming Dr. Swanepoel from UTCVM, who's been working with us with all of our bears, but really, really closely lately, it feels like, with our sort of unprecedented early neonate season. And for those of you who don't know or don't follow our social media very closely, we did receive two sets of twin cubs separately earlier than we usually ever do here at ABR. And so having to kind of navigate that neonate care for even smaller neonates than normal. And many of you, I'm sure, know the outcome of those neonates. One was successfully fostered back out into the wild, which Dr. Swanepoel came along for. And then the other three, unfortunately, did pass away. And so we're going to just welcome her on today and talk a little bit about why neonate care is so difficult and so hard, and why we think, we lost a couple of those little ones. But thank you, Dr. Swanepoel, for joining us. We'll go ahead and get started. And this is kind of just going to be a Q&A interview type style program. So I encourage folks, as you watch, to please type in any questions you have for Dr. Swanepoel in the Q&A or chat box, and I'll make sure to ask them to her. But first, Dr. Swanepoel, do you just want to go ahead and tell us a little bit about yourself, your veterinary career, how long you've been with UT, anything that you think is interesting or relevant of your background?
Yeah, well, thank you guys for having me. I'm really excited to be here and to have the opportunity to chat with you guys. Like Tori said, my name is Dr. Swanepoel. I'm over here at UT. A little bit about my background. I grew up in Georgia. I went to UGA for undergraduate and vet school. And after I graduated vet school, I started an internship here at UT, where I spent 50% of my time with the zoo service. And that is the service that, of course, sees all of the bears. And then they kept me on as the zoo resident here. So I will be here for another 2.5 years. So be here at UT for 4 years total. I'm very excited and glad to be here. But yeah, I want to be a zoo vet. So I'm in a zoological medicine residency that's 3 years long. And my long-term goals are to hopefully end up at a zoo somewhere in the US.
Very nice. Yeah, I was going to ask, I know you're in the zoological medicine side of things. So is that just how they split that up between, sort of pets, I guess, between cats and dogs? And then that there's, of course, for like zoo or wild animals. Is that what the difference is there?
Yeah, so we have here at UT, we have a zoological medicine service, which is very ambulatory. And then we have actually a separate zoological companion animal service, which is the service that sees all of our exotic pets. So all of the small furry animals, all of our reptiles. So client-owned private pets, those all go to a separate service, the zoological companion animal service, which I also spend some time on. But I'm mainly on the zoo service, and we work with institutions like the Appalachian Bear Rescue. And like I said, we're pretty ambulatory, so we're kind of always on the road going wherever we're needed.
Yeah, and we can't stress it enough. We've talked about UT on our social media a lot, but they are an amazing partnership. We couldn't do what we do without them, especially in instances where we have these tiny neonates or bears that need surgery or pins in their legs. So it's been just a great, we are so thankful that we have them so close to our facility. And so kind of along the lines of that zoological veterinary world, we sometimes kind of run into these cool things when we're picking up or dropping off bears. When we were going to help feed the neonates one day, I know they were about to try and immobilize an otter. So we kind of run into some of the unique and cool situations that the veterinarians get to do as well during our trips to and from UT. And so speaking of like that otter, what other sort of institutions other than ABR are you helping currently with your residency at UT?
Yeah, so I think I have a pretty cool setup. I have a pretty cool job, I think. So this residency, like I said, is very ambulatory, which means we work with a lot of different institutions, which is a wonderful way for me to gain experience and a wonderful way for us to serve our community kind of all throughout Tennessee. So We are contracted to be the primary vets for Zoo Knoxville. So all of the animals at Zoo Knoxville we take care of. So we do go to them pretty regularly, at least a few times a week, to do their regular primary care, any emergencies, surgeries, all of that. We take that primary responsibility. We also work with some smaller sanctuaries. So there is a tiger sanctuary that's close by that has 200 to 300 big cats. That tends to keep us pretty busy. So we do a lot of big cat work as well as some areas, some places in Gatlinburg that have like native wildlife. There is somewhere in Gatlinburg that also has bears. So really anywhere where there are non-traditional species that we need to go out and see kind of in our area within sort of a 2-hour radius, we tend to be their kind of primary vets and take on that care.
Yeah, that's very, very, very cool. I agree. Very awesome that it's ambulatory, as you explained and described it, and getting to experience all those different kinds of species. Um, so kind of diving in a little bit more into, what we've been working with you guys very closely recently. Again, it is neonate season for black bears, which means it's time where they are giving birth out in their dens. And like I said, we have received 4 neonates already this year, which is pretty early. I would say the normal sort of first day that is still early, but that we've seen them arrive to us in the past is Valentine's Day. And we saw, these cubs at least 3 weeks before then. So very, very young, we're estimating a couple days old when they first got here, especially when we're talking about nibbles and bits, were the first 2 that arrived. And so can you just explain, sort of medically and biologically what we mean when we say neonate? I found this definition online, and I thought the mammal part was interesting because I didn't know beforehand if it was just in terms to mammals or I guess when you guys think about neonates at the clinic, what are you thinking of and what kind of things do you have to consider when you care for them?
Yeah, this is a really good question. And I think that sort of umbrella term of neonate and the definition that it's an animal that's less than 4 weeks old sometimes doesn't fit for all of our species. So I think in general, a neonate is a newborn that is at a higher risk of developing complications because they have not yet developed the really any of their own immune system. They are having trouble kind of managing their own blood glucose and their hemodynamic status. And by that, I mean that they have trouble kind of maintaining their blood pressure. So to us, a neonate is an animal that really can't care for itself at all and is in sort of a very critical period of their life. And for a neonate is different for every species, right? So there are some animals where they're born and they're completely walking on their own, like, a horse or an elephant. And then there are animals that are born like bears with their eyes and their ears closed and they don't know what's going on. And I think that animals that are, sorry, this is about
Triage dial 5655, triage dial
That's fine.
5655.
I'm sorry about that, guys. I'm still in the hospital. So with animals like bears, where the babies take a long time to develop, I think they're neonates for probably longer than 4 weeks. So I think our bears that we had were potentially older than 4 weeks, and I would still consider them neonates. So I think that's a very fluid definition, and we don't have a great cutoff for every species saying this is a neonate, and then this is where they turn into a more stable cub. I think that's different for every species, if that makes sense.
Yeah, it does. And I don't have the exact statistic right with me right now, but in past research for these programs, bears do experience delayed implantation. And so that's part of the reason I think going along with what you're saying that they're considered neonates for maybe even longer because they're sort of born almost premature, if you will. And that's just biologically how they're meant to be, in that the female doesn't implant the fertilized egg until fall, where she's had enough fat and food reserves added on and her body decides if she can have a litter that year. And so we're thinking this is where the statistic, I'm trying to do the math, is probably 3 to 4 months gestation before actually giving birth. And so if you're thinking compared to other animals, obviously humans, 9 months, very short gestation in comparison. So, you know, they're born like Dr. Swanepoel said, can't see, can't hear. And what is so critical about being with their mother at this age? Specifically, something we talked about, I know when you came to the fostering of BITS was colostrum and antibodies from their mother. Can you speak to that a little bit?
Yeah. So colostrum varies in importance depending on the animal and the type of placenta that the animal has. I'll try to explain this without kind of going on a very long rant here. But colostrum is essentially a mother's first milk where she has a lot of active antibodies that the baby will ingest. And there's a certain cutoff depending on the species. With the time that they can actually absorb those antibodies through their GI tract. So in order for them to absorb antibodies, there needs to be sort of a gap in their GI tract in their cells so that they can actually absorb those antibodies. And then typically for mammals, they close that kind of window closes at 2 to 3 days. And so they're not constantly taking in those antibodies as they get older. It's really just that critical point of like the first 1 to 3 days where they can actually get those antibodies from their mom. And so that's really important. And, you know, we're assuming that all of the neonates that we got were at least with their mother for 2 to 3 days. So in theory, you know, it depends also on the mom, you know, was this the mom's first litter? Oftentimes when it's the first time the mother's producing milk, it doesn't have a lot of colostrum in it. You know, there's the maternal factors, but we are expecting that those neonates at least had the opportunity to take as much colostrum in as they could. And that by the time they got to us, that sort of window closed where they could absorb those antibodies through their GI tract. Does that make sense?
Yeah, it does. And thank you for explaining that. That kind of takes us to my next. This is a short video I'll play for you all of one of the recent neonates at UT getting bottle fed. So I'll play that real quickly. So that one looks like he's kind of fallen asleep right on the bottle there. But in relation to, as we talk about, you know, mother's first milk, how does that compare then, as far as we know, and what research is out there, which I know is really limited, especially with black bears, to the formula that we're able to give them?
Yeah. So like Tori was saying, we don't have a lot of information on the exact milk composition for black bears. And so we can only do the best we can do. Sorry, this is going to happen again.
Step to the parking lot with a gurney. Step to the parking lot with a gurney.
Sorry, y'all. This is a hospital.
Oh, that is fine.
So, well, I lost my train of thought. What was I talking about?
The mother's milk in comparison to whatever formula. Yep.
So based on what we know about the composition of black bear milk, the closest thing we have is a formulated milk that is made for beavers. So it's a beaver milk that's really high in fat. So we know that bear milk is really high in fat, and that's one of the commercial diets that's sort of the highest in fat. And so we use that diet. But the thing about mother's milk in general is that the composition of the milk changes minutely almost every single day. And there's no way that we can imitate that for any animal, for any species, even dogs and cats, where we know a lot more about them and how to take care of them when they're younger. We can do the best we can, but we really can never perfectly imitate the composition of the mother's milk because it's changing almost every day. And as those cubs are getting bigger, the composition, like the amount of fat, the amount, you know, of sugar, it does change kind of as the babies age. And so we can try our best, but we really just can't imitate that.
Yeah, and the formula that she's talking about, that is the same formula we use at our facility for neonates at ABR. So, you know, they're getting the same formula at UT versus in our cub nursery at ABR. And like she said, it's just, you can't mimic it exactly. And so in terms of how we're feeding them, you can see here we have a really small bottle. This bear is really small. I think this is BITS bear. And you know, we did do necropsies on those that passed, and the 2 earlier cubs that passed, which would be Nibbles and Polly, did come back showing that they had pneumonia. And our followers on our social media have seen us talk a lot about aspiration pneumonia. Can you explain what that means and why that's so common?
Absolutely. So aspiration pneumonia is essentially when an animal or a human accidentally aspirates or breathes in a liquid. So it can be milk, like in the case of these neonates, it can be vomit, food, anything else enters their lungs. And then, the lungs are supposed to be really sterile. There shouldn't be anything down there. And so when that gets down there, it's the perfect media for a bacterial infection. We can try our best to make our milk as sterile as possible, but it's never going to be. So when they aspirate something that's not supposed to be in their lungs, then it kind of sets them up for infection. And we try our best to mitigate that risk in puppies and kittens and all the neonates that we take care of. But the challenge is that they can do what's called silent aspiration, which happens in human babies as well, where it's not obvious. So there is sort of an obvious form of aspiration where the baby will start coughing, will be really stressed, really in distress. And then we can say, okay, we think that this is what happened, but that never happened with any of these neonates. And so what I'm suspecting is that they were silently aspirating, which means that they had some milk enter into their lungs, but had no reaction to it at all. And so that's really challenging because then we have to decide, well, are we going to put all of the neonates that come into our care on antibiotics immediately because we can't say for sure that aspiration didn't happen, with that risk that we're putting a newborn baby on antibiotics and there's risks associated with that? Or do we do our best to try to monitor it? And I think that's a really challenging thing to navigate. And that's something we were sort of rethinking every day as we were taking care of them.
Yeah, and I mean, you guys were checking their lungs with stethoscopes, you did radiographs, that, the absolute best care, and the fact that that can still happen silently is probably the scariest part to me and the most difficult. And a follow-up question I had about that, Dr. Swanepoel, was, you brought up antibiotics. And I guess how do you guys weigh the considerations between treating with maybe harsh antibiotics for something so young as a preventative? Has that ever been done, or is that something that, again, you just kind of have to weigh the cost and benefits?
Yeah, I think, even this season, having these 4 neonates coming so close together has been a really big learning opportunity and experience for all of us, including the vets here at UT. So we, in the beginning, we didn't think, hey, we need to start prophylactic antibiotics because these animals are apparently healthy. They just got orphaned, and we are going to put gloves on. We're going to try to avoid the risk of introducing anything to their very naive immune systems. And, in theory, we'll be fine because we do that for puppies and kittens. We don't automatically put them on antibiotics. But then as we kind of learned about the cases. So when Polly, I believe it was Polly, yeah. So when we took x-rays on Polly, and Polly had pneumonia, we did start Carolina on antibiotics, and she didn't have evidence that she had any aspiration pneumonia. So we were reactive in a sense that when we were like, okay, they keep, they're developing aspiration pneumonia, let's try to prevent it in the others. We did react in that way, but it's not a typical protocol to start a neonate on antibiotics immediately, because it's really important when they're first taking their milk in that their GI tract is allowed to develop that really beneficial bacteria that's supposed to grow in their colon in order for them to better digest their food and to grow. And it plays an important role in their developing immune system too. So you don't really want to start them on antibiotics immediately. So it is a really difficult decision tree that we have to navigate. And I don't know if we're ever going to come up with a standardized protocol for these really little guys, because I think every single one's going to be different.
Yeah, I agree. And so again, one last thing about the pneumonia, because I saw this a lot too, is the bottles that we use, and is there a way to prevent it? And I guess kind of along with that, does it happen to animals in the wild? Do you know if it happens? Like, is there a reason why it happens seemingly with bottles versus, say, just nursing naturally from their mom?
Yeah, I think that there are a lot of things that a mom bear can provide to her babies that we just can't do. And one of those things is that the structure of the nipple is perfectly designed for a cub's mouth. So just like with human babies, they have a suckle reflex where their tongue kind of makes this little ring, and it's perfectly designed to have a nice seal on a bare nipple. And we don't have a, perfect 3D printed bear nipple that we can use. So, that's one thing too, is that the anatomy, we're never going to be able to make perfect of a bear nipple. And each nipple is a little bit different. And we find that in dogs and cats and probably bears too, the individual neonates take a special interest in a specific nipple, and that's the one that they'll go to. And so it's hard to standardize something when it's different for every single neonate. And also, I think something that plays a role is that when these babies are hungry, they can go to the nipple at any time and just eat as much as they want and then go back to sleep. And then they sometimes will wake up maybe 15, 30 minutes later and say, I'm still hungry, take a really small meal, and then go back to bed. And that is not something that we can replicate in, managed care, regardless of how committed we are, because they're not getting the same feedback from us as they are from the mom. And so I think there's a lot of things that we just can't replicate, unfortunately. So I don't think that this happens with frequency in the wild. I don't know of any studies where they have actually looked into this, but I anticipate that the incidence of this happening in the wild is pretty low.
Yeah, and when she says, even from nipple to nipple, I mean, it could be the same nipple like we're seeing in this picture here, and the hole itself that we or the vets create is a different size. I know Bits, for example, needed a smaller hole, I think, than Polly and Carolina. And so really fine tuning even specific nipples that are the same on the outside, but maybe a little bit different based on what we're able to adapt them like, is also something that we have to do and work on as well in their care. So as far as, aside from feeding, which we've talked a lot about, is there a typical protocol, I guess, when it comes to neonate animals? I'm thinking things like temperature or checking respirations or things like that. What kinds of things did you guys have to check, or were you checking daily for these neonates?
Great question. So these guys definitely kept us and our ICU nurses very busy, because since they are so fragile and things can change within minutes, within hours, we really did focus on monitoring them as closely as we could, while also considering reducing stress by handling them all the time. So they all received temperatures every 4 hours, because especially when they are really, really small, they can't thermoregulate or maintain their own temperature at all. So they essentially mimic the ambient air. And so you have to essentially keep them at their body temperature. And then you also risk them potentially overheating. And so we focused a lot on taking temperatures every 4 to 6 hours, also taking blood glucoses. So similarly to how they can't really regulate their temperature, they also can't really regulate their glucose very well. Their pancreases are still developing. And so you can see rapid declines in blood glucose, really high blood glucose, and you have to be able to detect that before it becomes a problem and give them supplemental dextrose, try to give them a feeding if they get low, because that's one of the things that can make a bear or, any baby animal critical really quickly. So we definitely were keeping our eyes on that, as well as having the nurses check a respiratory rate and respiratory effort, which means like how easily are they breathing every hour. So they really did receive round the clock care to try and detect these little nuances and be really proactive and reactive to their needs. And they really did require kind of fine tuning of their treatment plans every day.
Yeah, and I think the thing about temperature is really important that you pointed out too. I know when we took in the first two Nibbles and Bits, it was kind of warm in Tennessee. I think it was like 60s, 65, and I saw some comments about folks. It was warm. Even if couldn't we leave them for a little bit longer while we wait for mom? And what temperature would you say that is their normal body temperature? And so therefore, what temperature would the ambient air need to be for them to be able to live?
Yeah, so in really, really little babies, like 1 to 2 weeks old, their body temperatures are typically lower than they would be if they were adults. So our kind of target for very tiny neonates is about like 96 to 98 degrees. And as they get older, we're looking more at like 99 to 101, around there. And so if we had a bear, a brand new bear, 1 to 2 weeks old, just kind of out in the open air, that bear would probably get down to the 80s really, really quickly. And so to keep a bear that's brand new with no ability to regulate its own temperature at an appropriate temperature, we're probably looking at putting an incubator at around 100 degrees. So almost higher than what we're targeting for, which again, that means we need to monitor them and make sure that we're not warming them up too much. So it's a very kind of delicate give and take, and trying to make sure that we're keeping their bodies at a great temperature, because we can't be their moms. Their moms lay on them, and it's a
Mhm.
perfect temperature all the time. As much as we try, we just can't be mom.
Yeah. Yeah. And so just important, I think, to recognize that body temperature, because it does run higher in adult black bears than it does in humans. And then so when they're so young too, it's really can be detrimental. And I'm glad you brought up the incubator, because as many people know, we did get our first incubator at ABR, the same one that you guys have at UT, for any future neonates that we may get. Can you talk a little bit to how you would recommend keeping that incubator sterile, or how you guys kept it sterile while they're in the ICU, and things like lubricating their eyes, for example, that folks may not think about?
Yeah, so the incubators have two different really important settings. So the temperature setting, which is, pretty obvious, and then also humidity too.
Mhm.
And so aside from temperature control, we also need to focus on humidity control. And as far as keeping it sterile, I don't think we can ever make a sterile environment. So we would just clean with safe cleaners. We would clean off any debris, any poop, any pee. But to a degree, we can't make a sterile environment, and they're the only ones in there with blankets that they're interacting with, everything that they're interacting with, kind of in a very closed space. And so fortunately, we weren't worried that we needed to keep that area super sterile, but it is important to keep it really clean, because the bacteria that is in their poop, that's in their colon, if they ingest that in any way, then potentially we're worried about a source of infection, which, anything is a source of infection for a little neonate.
Yeah. Yeah, so thank you for kind of going over that protocol and the care they received in the ICU. The last main thing I want to talk about tonight is the fostering of Bits Bear, which again, Dr. Swanepoel got to go along with. She actually brought Bits Bear from UT to ABR, and we were able to all go to the fostering site. I'll play this video. It's a short video of Bits and his new siblings all together in our little cub carrier here, and you'll get to peek at them through this bubble here. And so he did get 3 new siblings. He's right there with the milk stain on his snout, probably from you, Dr. Swanepoel, getting his last feeding. I just want to talk to you a little bit about how that experience was for you, what you thought of it. We were so glad you were able to come along. I know you've talked a lot tonight about how we can't match up to a mother's care, and just kind of what you saw in that experience with Bits Bear.
Yeah. So I think we all agree that the best place for these neonates to be is with a mother. And so I'm glad that we were really working hard to integrate him into a new family. I think that was the very best thing that we could do for him at that point. And it was a really, really amazing opportunity. And I'm so happy that you guys let me come along. It was so nice to see sort of this family be reunited, and to see the whole process, and, immobilizing mom bear and getting her out of that really tiny den that was so small. I'm shocked that she was able to fit in there. And then seeing that all of Bits's siblings were very similar in size was a way for me to kind of get some reassurance that, I was worried that Bits wasn't growing fast enough, and to see that his siblings were very similar size was just a reminder that every single species grows differently when they're younger. And that was something really reassuring for me, that these bears actually grow quite small when they're in the den with their mom, and then they kind of explode in size when they come out. So that was something that I learned seeing what the babies looked like in that moment and during that season. So it was really nice to see Bits immediately latch on to Mama Bear's nipple and start nursing and integrate in with all of his siblings and kind of get their scent all over him before we reintroduced him to Mom, and seeing Mom go back in the den and take care of the babies was such a really heartwarming experience.
Yeah, and so we did post about this on our Facebook, so you can scroll back and see some photos from that. So what she's explaining about the den, she was in a really tight den space, seemingly for us and seemingly for her, but after she was awakened from those immobilization drugs, she just kind of stepped out of her den and then circled back and went right back in with no trouble at all. She was probably over 200 pounds, I would say, that Mama Bear was. So it's just amazing where they can fit. They're kind of like, I think it's mice that people describe, if their head can fit, the rest of them can fit. And so that's exactly what we saw. And like Dr. Swanepoel said, Bits was, we placed him in first and he immediately took to the nipple, which just again goes to show how, how their instincts really kick in. No matter that he'd been bottle fed for a little while, he knew immediately where to go. And I did have a comment or question pop up from you guys about follow up with Bits and his new family. And we usually aren't able to have any sort of follow up. We leave that up to the wildlife agency where they returned back to. And so maybe they'll have an update for us. If they do, we'll be sure to share with you all because we'll be excited to hear. But for the most part, once they're either released or fostered, that's their new life as a wild bear or bear cub. And we just can wish them the best and hope that we were able to do the best. And again, I think we did do the best we could for him, a lot thanks to you guys at UTCVM. And it kind of relates back to sort of that weighing of, antibiotics or not antibiotics because they're so small, this decision to take him out of the ICU, letting him get stronger before fostering or just go ahead and foster. Can you talk a little bit about sort of weighing that decision? I know the day before actually, we were looking at his umbilicus to make sure that everything looked okay there and just nervous about that decision of taking him out of the ICU versus, getting him back into a wild den as fast as possible.
Yeah, I think it's not a clear decision, right? So Bits was in a very different environment for a little while. So he didn't have that opportunity to develop his immune system against all the things he would be exposed to there in the den. So that's definitely one consideration we had. But I think the biggest thing, and we've touched on this a lot just in the 30 minutes that we've chatted, is that we can't mimic the composition of the milk. And I think that they probably get a lot out of the mother's milk that's more than just nutrition. And additionally, just being in the den with Mom and Mom being able to better regulate their temperatures and him being able to get feedback from his siblings about when to feed and just kind of growing in a more natural way. I think all of us were on the same page about that being his very best shot. He didn't actively have any evidence of having an infection, so that's not something that we were concerned about. And I think just getting them out of the ICU and into a more natural environment is the most important thing for their overall development too, because I think there's a lot of things physiologically that we don't see that are important for development that probably require feedback from their mothers. So I'm glad that we had the opportunity to integrate him into a family a lot younger.
Yeah. Thank you for that. And I would agree. It was the best outcome for him. And again, we couldn't have done it without you guys. So I'm going to end with one more question that I have. So if anyone in the audience has any questions for Dr. Swanepoel, please type them into the chat or Q&A box. But we're approaching springtime, and springtime means babies of all kinds, more bear cubs, baby birds, baby deer. Do you have advice for folks that maybe come across these neonates or really young wildlife babies in the wild and what they can do, what the most important thing to do for them is? I would imagine some sort of warmth, and how that they can be of help without, interfering too much with them.
Yeah, this is a great topic. I love to talk about this topic. So I think the very first thing when you come across any baby is to figure out should this baby be here or should it not be here? Because when babies start to get older, regardless of what type of animal it is, they do start to explore without their mothers. And there are some species like deer where their mothers leave them for hours. And so it's important to know, like, does this baby even need help or not? And if you pick up a baby that doesn't need help, obviously you're not doing that baby any good. So I think before you even pick an animal up, unless it's obviously in distress, so if it has a wound, if it looks like it's sort of minimally responsive, if it looks really sick in any way, of course, then you can, take that animal and seek care immediately. But there are a lot of resources. One that I recommend that I really like is the website Animal Help Now. It's sort of a database that no matter where you go, you can put in your address or your zip code, and it will put you in contact with the nearest wildlife rehabilitator or veterinarian that sees wildlife. And I think there's even like a chat function where you can say, hey, like, this is my situation. What do you think I should do? And there are people who are more qualified to help you make that decision that can get back to you and help you navigate that. I think in general, when you find a neonate, the biggest thing, if you do choose to take it in, to take it somewhere, is to not feed it anything. I think the knee-jerk reaction is like, oh, this baby, its blood sugar must be low, so we just have to get something in it. And that's actually pretty counterintuitive. So when an animal that's been abandoned has been abandoned and it needs help, they actually become dehydrated a lot quicker than they become kind of devoid of nutrients. And so if you give a dehydrated animal food, it actually can lead to infections in their GI tract. And if you give them food that they're not familiar with, it can also cause dysbiosis or overgrowth of bacteria in their GI tract and can make them quite sick. So if you find a neonate, try your very best to get as much information as possible before picking it up. Seek care immediately. Please don't take the baby in and try to take care of it for several days, because unfortunately, sometimes we see people who really mean the best and tried the best and, looked things up and did everything they could, but there were things that maybe could have been done differently for that baby. And we've spent 30 minutes talking about how fragile these guys are. So I think just trying to seek care immediately is one of the most important things when you find a baby in the wild.
Yeah, those are great points. Thank you. And we do have a question from Jeanette. How many neonate bears would you say that UTCVM has had? And then are most of them from ABR, or have you seen other neonate bears?
I don't think we've ever seen a neonate bear that wasn't from ABR because we don't have the license to take it anywhere, to release it, to take it to its next step. So without the guidance of a rescue organization, we wouldn't be able to navigate those next steps. So as far as I'm aware of, the only bears that we've seen or hospitalized are from ABR because we know that they have somewhere to go after we take care of them. And that's really important. You can't care for a bear and just kind of boot it out. There has to be that in between where you get them strong and get them prepared and ready for release. And we can't do that here in this hospital. And we, also aren't licensed to raise and release bears. So it's all ABR. And I think we can all agree this is a weird neonate season where we've seen a lot of really young bears, and this is not something that is a typical pattern that we see in the past years. I've only been here for 2 years, but from what I've heard from others who have been here a lot longer, we've seen neonates this young before, but it's been very kind of sparse, like several years ago, maybe one like every few years, not a cluster of them like we're seeing this year. So I think this year was very unprecedented in a lot of different ways.
Yeah, it definitely was. Nibbles and Bits came on the same day in January that we have had one other neonate come in our facility history, and that was back in 1999. And that neonate also did not thrive and did not make it, unfortunately. So I think there is something to be said for sort of this hump of growth that they get over, that they can come to maybe rehabilitation or veterinary clinics and thrive versus those really, really delicate early, weeks, days, when they're really just so young. So really want them to be with their mom, always, but especially during that really crucial newborn stage. And I think that's all of our questions that popped up. So with that, thank you so much, Dr. Swanepoel, for taking the time. I mean, you're at the vet still, so thank you again for taking time out of your work to join us and talk to us a little bit. We really appreciate it.
Oh, no problem. It's my pleasure. I'm happy to chat with you guys. I know I can't see all of you guys, but thank you so much for supporting ABR, for supporting us too. You know, ABR is a wonderful learning experience for all of us. And I think that we're doing a lot to improve our knowledge on the care of these bears. And we can't do it without you guys. So thank you so much for all of your support.
Yeah. Yep. Thank you so much. And I hope everybody has a good night. Thank you.